My name is Lauren Geller. I'm an orthopedic surgeon here at Verdugo Hills Hospital. I want to welcome you tonight to this presentation. And this is the first one we're going to be taping. They can be able to view it later on the internet. We'll see how that goes. We'll check it out. But feel free to stop me during the presentation for some questions. And then afterwards, we're going to talk a little bit, answer your questions, and talk about some things you may be interested in. You're out here tonight because I assume you're interested in this topic, and so am I. So we'll go ahead and get started here with the first slide. Just talks about, what are the pathways to being in sports medicine. This thing's a little touchy. And there's a lot of pathways, not just specifically through orthopedic surgery, even through being a physician. And everybody has different interests and different ways to go. So I thought maybe there'd be a lot more students here tonight to view us. But just quickly, I'm an orthopedic surgeon, so that's under specialist. There's also a big need for primary care doctors, at every level of sports medicine, taking care of all the athletes. And with that, the physical therapists do a great job in getting our patients better, after surgery, even with no surgery. Athletic trainers are the guys you see out on the field, on TV, running out to the football player when they go down on the field. They're an integral part of this whole picture too, and really is a team effort, including the coach and the psychologist, nutritionist, team effort to really keep the athletes healthy. And we'll talk a little bit about organized athletics, high school and whatnot, but also we'll talk a little bit about with the so-called weekend warrior or everyday people, because obviously people are doing more sports these days, and it's not just whether you're in a league or whatnot, it's on the weekend with your friends and everything like that. So the goals of today's lecture, we'll go through them. One is to discuss age in sports, and you'll see that's a broad topic. We'll talk about some common types and common injuries and causes of injuries that we see. Mostly be focusing most on musculoskeletal, because that's really my specialty. Obviously, there's other injuries, including head injuries and other things that are quite hot topics now if you read a newspaper about concussion and things. Won't focus specifically on that, but mostly musculoskeletal today. Discuss some injury treatments, common treatments, maybe you can even employ in your everyday life for other things other than sports. I like to touch on some prevention, which is always important. And then at the end, we'll talk about some real specific things, more common things that I see in the office, things that you probably have had yourself, and we'll go from there and see how it is. So the first thing we'll talk about is age in sports. And as we see that, not all athletes are the same, from age to gender to, even everything else. And again, not all sports are the same. So one sport has a higher incidence of this injury or that injury, and that's part of what makes this sort of fun, is trying to figure out the riddle of the injury, from the mechanism to everything else. So it's really a broad range of ages and different activities. Different age groups certainly suffer different types of injuries. Injuries in children are not necessarily the same thing you'd see in an older person or older athlete. And really a key point that we're going to touch on is that children and adults are really not the same. Children are growing, they have different bone structure, and they really suffer from different ailments for the most part. And for the most part, they're very active too. We'll say that young athletes are not small adults. They used to hammer that home in medical school, that you can't just treat them like an adult. You have to treat them like a child. And in fact, there's a whole branch of pediatric orthopedic surgery that deals just with children. Just an example, we'll look at an X-ray. This is a knee X-ray, both a child on the left and an adult on the right. And you'll see this line. Well, see if we can work the computer here. This line here is the growth plate, and you have it both on the tibia end. This is the femur, your thigh bone. This is your tibia, your shin bone, and that forms the knee joint in between here. You can see this line here. That's the child's growth plate. That's where the bone's getting longer. The bone is growing, as you see in the adult, that It's fused. When you become fully skeletally mature, the growth plate fuses. Obviously, you don't get any taller once you become an adult. But this growth plate actually represents a weak link in the chain of energy. So an injury may do a lot to injure the growth plate. And sometimes in children, that growth plate is weaker than some of the ligaments and the surrounding bone. And so you might get an injury there. We'll talk a little bit later about a growth plate injury. And that being said, also, young athletes of different ages can have significantly different size and physical maturity, even if they're the same age, same gender, very much different, and you have to treat them accordingly. So just quickly, I just wanted to show you regarding kids that it's not an uncommon thing to see injuries in children. Obviously, there's a lot of kids playing sports. Probably not too, the football is the worst. Most injuries in football, it's called a collision sport. There's not a lot of ice hockey being played in the Los Angeles area, but similar type of collision sport with a lot of injuries. Basketball, baseball, soccer, all have their share and typically have different types of injuries. If we look down here though, playground injuries, almost more than basketball. So I can tell you, seeing an inordinate number of kids come in the office have fallen off of the monkey bars or whatnot. So the good news is that there's been a lot of a push for safer playgrounds, safer surfaces for the children. And we'll see later under prevention that safe surfaces or safe playground is really essential. And there's recently been a lot. I don't know, when I was growing up, there was these really structures with splinters and concrete and all this stuff, and now they have all this padding and sawdust and stuff. So that's, I think there's been a lot of research gone into what's the safest and what helps prevent injury. So we talked about kids a little bit, but let's talk about a little bit older athlete and the so-called baby boomer. We're not going to really focus on the date, but that just gives you a rough idea who we're talking about. And there's certain injuries that are more common. We'll see a little bit later. I'll talk about some of those in this age range of athlete that you'd see in this person, but not in a child, or otherwise. And we see that's not an uncommon problem. We see many people in the office with sports-related injuries. Not an uncommon problem. So if we look at this age group, we'll say that really we're big proponent of exercise. You got to stay healthy. You got to exercise. Just for everything from heart to lungs to staying in shape and fighting obesity and things. So exercise is really key, and so that's sometimes difficult. We don't want to get hurt doing exercise, but we want to make sure that everybody's really pretty healthy and doing some exercise. One thing I wanted to kind of talk about a little bit is bicycle accidents are very common. And obviously head injuries in young children are much easier to get over. They represent a very significant higher mortality rate in an older person. And a lot of it may have to do with the helmet. I think in California there's a law you have to wear a helmet if you're under 18. I don't think that there's a law about an adult, but there is one for the motorcycle. And I would really encourage you, if you're going out biking, even if it's around the block, to consider wearing a helmet. It really makes a huge difference as far as injury. We see a lot of tendonitis, bursitis. You see these words thrown around. We'll talk about that a little later, what specifically we're talking about. Tendonitis, golfer, tennis elbow, sprains and strains. Those are the prevailing types of, overwhelming types of injuries and problems that I run into. I wanted to briefly touch on, when should I go to the doctor? And sometimes that's a hard thing to know. So what are the criteria for me to really go to the office and be seen, or even the emergency room? And these are some general guidelines. Obviously, you got to use your judgment, where you, in your experience. Generally, if you can't play, it's probably a good idea. Most people are pretty competitive. They want to play. If they can't play, then they come see me. Or they have decreased ability. They say, well, I've been playing and now I really feel like I can't play up to my potential, or this injury's nagging me, I can't get back. Visible deformity is a really good clue. You know, if everybody watches now that they have the internet, YouTube has all these gross out videos on people getting hurt and things going on, but that's usually a good clue. Typically go to the emergency room for that because you want to be treated appropriately. Severe pain is also a good key that the injury is more severe and probably needs to be looked at quickly. And just before you go, you want to kind of figure out what are your symptoms, because I can tell you a lot of people come in and, you know, it's very sometimes overwhelming. And so if you kind of thought about it ahead of time, it really makes it easier. It makes it, it helps me, it helps you, and, you know, get to the cause and how we're going to get you better quicker. If you have a very significant medical history, it's good to bring that and your medications. Those are very helpful, obviously. Most doctors fill out the huge amount of stack of paperwork in the waiting room with all those questions, but it's good to have those available and at your fingertips, you know, if we ask you a question. Just makes it easier. And, you know, before you come in, even write down your concerns, bring them with you. Because sometimes when you hear a lot of information, there's a lot of fancy words, you're not really sure, you know. If you wrote it down, then you can say, you know, what are my real concerns? What am I worried about? And then while you're there, you know, if I tell you you've got XYZ type of problem, you say, well, tell me the name of it, maybe even the medical term, or even the, you know, what's the common name for it? What am I supposed to expect from the treatment? And how is this going to affect my daily activities? You know, if I put you in a big cast with in crutches, you know, how's that going to? Can I drive? You know, can I get around? Can I take my kids to school? That sort of thing. Can I put weight on it? If I can't put weight on it, how am I going to, you know, do things around the house? So these are all pretty important things you may not think about, you know, in the moment when you're there. So if we move on to, you know, what are the common types of causes of injuries? If you break it down into two big categories, there's the acute injury, and that's obvious. You know, you're playing tennis, you're playing a sport, and you get hurt. Something happens, and that can be a car accident. That can be you fall off a ladder, that sort of thing. That's a broad category, and we'll talk about some of those. And then there's another category, the overuse types of injuries, and that may not be so obvious. They say, well, it's been bothering me for 3 months, and it's been getting worse, and I didn't really wake up, or not one thing happened. I got injured, but now it's really bothering me and I can't do what I want to do. So that's a series of overuse injuries. We'll talk about that as well. That's really a spectrum. So from a musculoskeletal standpoint, what can get hurt? What can be injured? And there's a lot of things that can be injured, basically everything. Muscle, most commonly muscle, tendon, ligament, bone, joints. You know, there's other things too, major organs and things like that, brain, that sort of thing. We're not going to touch on that specifically, but basically everything in your body can be hurt one way or another. But those are the common, you know, if you look, most common types of injuries. So so we know what can be hurt, but how does it get hurt? So an abrasion or a laceration, those are cuts. Abrasion's like a scrape. Some people call it road rash. Fall off your bike and you get scraped on the arm. Lacerations are a cut. If you think of a knife, you can get, that's more of a laceration. It's a clean cut. Sprains and strains. So sprain typically is associated with muscles and ligaments. They get strained. And there's a spectrum of those too, from micro tears, microscopic tears, to full tears. And that's under tears too, for ligaments and tendons and things like that. Contusion's a bruise. You get hit with something. I don't know my slide of the guy getting hit with the baseball pitch, but that's what a contusion. It's a bruise. You get a black and blue mark. Tears, you can tear ligaments, you can tear tendons, you can tear cartilage. Those are the most common. Joints are the things that can be dislocated. So a joint typically is a combination of two bones come together to form a joint. And that joint obviously provides movement. Because if we didn't have joints, we wouldn't move very fast. And we'll talk about shoulder dislocation later. Dislocation is the joint comes unglued, basically. Fracture is a crack in the bone. I've had a lot of people say, well, is it fractured? Is it broken? Is it cracked? Is it, you know, those are common. And for the most part, if you have a fracture is a disruption in and the stability of the bone, so it's been compromised. Same as a crack and a break. There's different grades. The more energy you apply to it, the more pieces it gets in, or the different configurations of fractures. And it's a little beyond the scope of this talk, but a twisting injury causes a different type of injury to a bone, a fracture to a bone, than does like a car bumper or something like that. So those are the kind of the common things. If we look at how do we treat them, and we'll get into some real specific common injuries at the end. Common injury treatments, there's what's called the RICE treatment, and we'll go through, it's an acronym, the RICE, relative rest. So instead of saying complete rest, and sometimes complete rest is the solution, but for the most part, we're talking about relative rest. Taking it easy, not continuing to do whatever's hurting you. And sometimes that's the key. That works a lot. That comes a lot to do with the overuse injuries. Obviously, you twist your ankle, sprain your ankle. Can't get around very easy. Can't walk very well. For a while, you'll rest. You're not going to go back to sports right away. Ice is a really good tool to use. It's very good at relieving pain and anti-inflammatory, and it's not very expensive, and it's easily accessible. I usually recommend about 15 to 20 minutes on and then about an hour off. Not infrequently, I have someone come in and put the ice pack on for 4 hours, and they have frostbite or injury to their skin. You can actually burn the skin. I've had a couple people do that. Try about 15, 20 minutes. You can do it again after another hour. Just give your skin time to recover a little bit, because too much cold obviously is not good. Compression is things like braces or ace bandage, wrapping it, and that I don't have a picture of that, but that's what compression means. Putting an ace bandage around your sprained ankle, for instance. Elevation, similar to what's going on here, although he's stretching his hamstring here. The swelling is relieved with elevation. So if you have something that's really swollen, the way to get that swelling down is to keep it above your heart. And the higher you can, the better, although whatever's comfortable. You don't want to try and hold your leg up by yourself like that. That's not terribly comfortable. When you have decreased swelling, usually it helps with pain too. It decreases your pain as well, so that's helpful. So the combination of these is the RICE treatment, and those are real common, real easy things to do for even common things, sprains and strains and bruises and whatnot. More advanced type of techniques would be real rehab, as shown by this gentleman here, physical therapist, and that works for certain things. For the most part, it's pretty good. It's not necessary for everything, but most of the time after surgery, you need some sort of physical therapy or rehab. Rehab can consist of just resting, and then resting from your sport, and then getting back into the sport slowly on your own. Working your way back up. It doesn't necessarily mean it has to be in a physical therapy setting. Anti-inflammatory medications. We're talking about things like Advil, Aleve. There's all kinds of fancy prescription strength ones too. Those are fairly good medicines. Tylenol is not an anti-inflammatory. So we're talking about Advil. It's a medication though, so even though it's over the counter, you don't want to overuse it. You want to be real careful with it. It's not completely innocuous. Everything has side effects. And it's not really that great to take it for a long period of time. Short spurts is usually fairly okay. Common side effect is stomach. You get some gastric side effects, some acid. You always want to take anti-inflammatories on a full stomach. Braces are real helpful for certain things. Protects it, it provides compression and stability to the joint. It lets you rehab, and even some braces we use in sports. So they come back after their surgery, put them in a brace when they first start their back to sports. And then surgery, certain things need to be fixed. We'll talk about ACL tears at the end. Surgically, and sometimes surgery is left over if nothing else is working. So I'd like to touch now on some prevention. Prevention warm-up is very important. Obviously you don't want to go out with a cold muscle. You need to warm up before you do an activity. A good way to put yourself at risk for getting hurt is to go out cold and do something. And a cool down is not as quite critical as a warm-up, but it's still fairly important part of this. We'll talk about cross-training when we talk about overuse injuries and stress fractures. Technique is pretty important, and that's where the coach and comes into play. You put yourself at risk for injury when you have improper technique. You know, if you think about pitching a baseball and you have poor technique, sidearm, I won't say sidearm is bad technique, but you know, not proper technique, not well coached, you put yourself at risk for injury. And so if you're well coached, if you have good technique, for the most part, that helps you prevent getting injured. If we look at the warm-up, we'll break it down into, you know, you break a sweat, you got to get the muscles warmed up, got to get you warmed up to go out and play at your best. You want to get your heart rate going, you know, get your body ready to go out and play your sport. Muscles warmed up, get them flexible, stretch. So warm-up is good, but it's two parts. It's warm-up and stretching. So stretching gives you, you don't want to bounce, you don't want to really stretch too much. You want to be nice and easy after you warmed up a little bit. And things like, you know, jogging, jumping jacks, that sort of thing, and then stretch the muscles. Depends on the sport you're playing, but it's a good idea to do a balance, both arms and legs. And warming up, the prevention and warm-up and stretching is really important in people recovering. People having a bad injury they have to come back from. You definitely want to do that. And you know, as we get older, it's harder to bounce back from injury, and so it's a good idea to be, as we all get older, to get a good warm-up program and really be good about doing that. We'll talk about another prevention. You know, we talked about coaching. You know, we need to be supervised too, especially children who, you know, need proper supervision. You know, bad things can happen if you hear about weight room injuries and things like that. So you really want to be well supervised. For everybody, it's really important to wear properly fitted, maintain an appropriate protective gear. You know, the gear has been designed and really been, for the most part, tested. We talked about bike helmets. That's really important. There's a reason they have that gear. You know, obviously, different sports have different equipment. But it should be well maintained. It shouldn't be falling apart. And you know, bike helmet has been in several accidents. Needs to be replaced. Safe surfaces. We talked a little bit about the playground. Same thing with you know, wet courts, tennis courts being wet, or you just want to be safe. You don't want to put yourself at risk by playing on an unsafe surface or one that's potentially compromised. You know, playing next to the street is probably not a great idea. Most sports, most games have rules, and some of them are for prevention of injury. You know, if you look at some of the football rules they instituted, they're trying to prevent injury. And one good example of that, I don't know if you're familiar with spear tackling, where you duck your head and try and tackle the player with your head down. A lot of C-spine injuries, cervical spine injuries with neurologic paralysis and things like that. And since they've really instituted that, it's been a dramatic decrease in that sort of injury. Still happens, but dramatically decreased that. And that's a rule. You're not allowed to do that. We talked about gear, equipment. You know, say, well, I just play through the pain, it'll get better if I keep hammering on it. If I keep doing it, it's going to get better. And occasionally there's things like that, but for the most part, you should. If it's hurting you and it's not getting better, then keep doing it. If you have fun, then you're less risk for injury too. So we've talked about the prevention and some common injury. Now we'll get into a little bit of specific types of topics, which I'm sure a lot of people in this room have had. Ankle sprain is probably one of the most common sports injuries across the board. Typically it results from a twist. They call it an inversion injury. We're trying to demonstrate this here, where you come down and on the side of your foot and you twist. What happens is that you have stabilizing ligaments on the outside of your ankle, represented by these white lines here, and those can get torn. There's there's different grades of sprain, from micro tears, microscopic, to complete rupture, like you see here, and there's different types of grades. But we've all seen you twist your ankle and you get swelling and you get bruising. And then at the basis of it, what we're talking about is injuring the ligaments. Some of you can stretch the muscles, and also you can injure the joint too. And if you have enough energy, if you have enough force that comes through your ankle, then you start with a sprain, but then things start breaking, and so you get ankle fractures and dislocations and things. The common signs of the ankle sprain would be pain, and usually it's lateral or on the outside of your foot. But depends on what position your foot is, and there's a whole describe different mechanisms where one's on the one side or one's on the other, and it just depends on how your foot is. Most common would be to tear the ligament here. They call it the anterior talofibrillar ligament. It's the most common injury. And because it swells up and it gets tender. If it's just a minor sprain, it may hurt you for a week or so, and then it kind of goes away. If it's very high grade, it gets very bruised, very swollen. You can't walk, and then you go see. You show up in the office, and I have to do an X-ray to make sure you didn't fracture something. So how do we treat that? So the Rice formula is real good for an ankle sprain. Decrease the swelling, decrease the pain, try and get you back out to sports. You may think ankle's an innocuous injury, but it takes many weeks to really recover and get back out there. Most of your body weight comes through the ankle when you're running or doing sports, so it's an important joint, certainly. Rehabilitation can be very important. What you have in these ligaments is you have nerve fibers that transmit what they call proprioceptive information to your brain. You're not really conscious of it for the most part. But what that is that your body's, where your body is in space. And so it can make fine adjustments to your muscles and to your stability. When you tear those, sometimes you can disrupt those, and so it takes a little bit of rehab to re-educate those muscles and those tendons, and typically the nerves can regrow. It's hard to measure, but as you do more and more rehab, you get better. Anti-inflammatory, like we talked about, is very helpful for this, and ankle brace stabilizes it, keeps it from moving, and those are the most common. For the most part, ankle sprain surgery is very unusual with this. So moving on, we talked a little bit about children and athletes. The growth plate is where the bone is growing. Here's a wrist. Before we showed you a knee. This is called the radius. The growth plate is here. You have growth plates in all the bones of your body. Most common, if you fall on an outstretched hand, child comes down like this, breaks their fall. You can get an injury through the growth plate. Either it can fracture through the growth plate, it can fracture behind the growth plate, or you can get mixed patterns where you can get fractures where a piece of this part of the bone they call the metaphysis, and then it goes partly through the growth plate and out the side, or it can come all the way through. This is Salter 4. This is a classification system, but the more energy, obviously, the worse it is. Most of these are treated closed. Children's bones have a potential to remodel as they grow and as they get longer. They can correct deformities to some extent, for the most part, especially ones around the growth plate. Cast or splint. Seen lots of kids run around with casts on. That's real common. Some require manipulation if the position is not that great. If the position, you don't feel that it's in a good position that it can remodel itself, or as the child gets older, you get closer to skeletal maturity, it may be necessary to manipulate it. If as they get closer, the closer they get to being fully grown, the less remodeling they have, the less correction they can have. So you want to try and give them a good shot by pulling it out, and that requires either a shot or sedation or some type of hospital or setting, and in some cases a general anesthesia in the operating room, depending on how bad and how angulated it is. Certain types of growth plate injuries require surgery. Those are the ones that have been shown to not do well if you don't put it back the way it goes. Most of those are around joints for the most part. If the joint surface is disrupted or it's irregular, then that needs to be restored. Growth plate fractures in children heal rapidly. Fractures in children heal very fast, and even faster near the growth plate. They stabilize very quickly and don't require as much immobilization as an adult would. And anytime you have an injury near a growth plate, you could have a risk of growth disturbance. The more energy and the worse the fracture, the higher the risk. And what a growth disturbance would be part of the growth plate, or the whole growth plate stops growing. And you can imagine, if we look back on this, if this part of the growth plate stopped growing, but this part kept growing and that part kept growing, obviously what you get is you get an angular deformity where this part would get longer, but this part wouldn't. And so you've got to keep an eye out for that. Make sure that's not happening, because there's usually that needs some kind of surgical correction. Not terribly common, and for the most part, that's good news. So that's the growth plate injuries. Meniscus tear is very common, a very, very common injury. The meniscus is a C-shaped structure in your knee. It's a shock absorber. So we look here as the knee. Femur's here, it's the thigh bone. Shin bone is here. This white stuff here is called the articular cartilage. It's the smooth bearing surface that your joint moves on. All your joints have this surface. This is your kneecap. It's sitting in front. It's superimposed here, but the back surface of this kneecap has that same cartilage because it's smooth. And actually the tibia has it too. You don't see it here, but both sides of the joint have this smoothness. The knee is obviously a hinge joint. We'll look at the shoulder in a second. It's a ball and a socket joint. The meniscus is this structure. You have two in your knee. They look like a C. And what it is it's a shock absorber. It's a cushion that provides stability and distributes force between the femur and the tibia as you move and you twist. You've got two stabilizing ligaments called the cruciate ligaments. We'll talk about injury to the anterior cruciate later. And the typical injury for a meniscus would be a twisting injury. The femur twists on the tibia, or the knee twists, and you can get a tear in the meniscus. There's many types of tears and many positions that you can tear it. Contact sports are a very common source of injury, like we talked about football. Obviously, if somebody comes flying in and tackles you right at your knee, then that can cause a tear in the cartilage or a disruption of your ligaments. Excuse me. And then the meniscus helps with cutting and pivoting, twisting types of activities where you're making change in direction. And so those are common symptoms. You say, well, I go to twist and I change direction. It hurts right on the inside of my knee. Very common to have a meniscus injury with associated ligament injury. If you have a bad enough injury, if somebody tackles you in football and you tear your ACL, tear your MCL or your stabilizing ligaments, very common to injure your meniscus as well. So what are the symptoms? You get pain. You feel like your knee is loose. It's giving way. It locks on you. It sticks. You can't unlock it. Or it clicks. And swelling. You feel like there's swelling in your knee. Those are the pretty common symptoms for meniscus. And what do we do about it? So there are certain types of tears that can heal on their own without surgery, but a lot of these do go on to need surgery. The meniscus, for the most part, a lot of it is avascular. There's no blood supply to it, so there's not a lot of healing potential in certain parts of it. How do you deal with it at the time of surgery? This is an arthroscopic picture. For the most part, these days, the surgery on the meniscus is done arthroscopically, which means you put the camera, there's a fiber optic camera that's inserted in the knee through a little incision, and you work through a little incision. It's a minimally invasive type of procedure. This is your femur here. It's not projecting very well, but the cartilage is, the white cartilage is here. It's a little rough. You can see a little bit rough. Meniscus is this in the middle. Tibia is down here. And this is very irregular. Normal meniscus is nice and smooth. I apologize I don't have a normal meniscus to show you here. But that's a definite tear. What do we do about it? So tears that have blood supply we can repair. I put some sutures in there and sew it back together and then try and get it to heal. That's good because it saves part of that cartilage. It saves the meniscus. Certain tears are degenerative. This is a pretty degenerative tear. You can see the tissue is kind of chewed up. Looks almost like crab meat for the most part. those tears typically need to be excised. They call that meniscectomy, taking part of the meniscus out, leaving the healthy meniscus behind. And that is a pretty good success for taking care of that tear, because there's no healing at that part of the meniscus. The inside of the meniscus has no blood supply. And even if technically you could put it back together somehow, glue it or something, there's no potential for the body to heal it. Moving on to the shoulder. The shoulder is a unique joint in that it's the most mobile. Obviously, there's a lot more motion in your shoulder than you do in your knee. And the reason you have that is because it's a ball and a socket. It has much less bony stability than a hip joint. Hip joint is also a ball and a socket. But the hip has a very deep bony socket. This bony socket, you can see it's more like a saucer even. And this is connected to your shoulder blade, which is this bone here. This is your humerus, it's your arm bone, and it forms a ball at the top. Part of the problem with the shoulder is it's the most mobile joint in the body, which is good because it needs to position your hand in space to do things. But because it's the most mobile joint, that also makes it the most unstable and prone to being the most common joint to dislocate. And usually takes a pretty good force to do it. It doesn't pop out for the most part with minor force. But there's certain people, we talk about multidirectional stability, certain people are just born a little bit looser than other people. Their joints are a little looser. You know, we all know the kid in school is double jointed and can put his thumb on his arm. Those people are more prone, and they have a different entity. We're talking about here is it would be an acute traumatic dislocated shoulder. Some people's shoulders come out because they're loosely jointed, and that's a different animal. We're not going to touch on that in this talk. And if we look here, you can see that the ball is well centered right in it's called the glenoid, or the socket. Here's the socket here. Here's the ball. So most common is an anterior dislocation. It comes out the front. It's hard to say on a one plane X-ray, but probably that's an anterior dislocation. So obviously this ball here belongs back over here. Having trouble with the computer. So how do I do that? So they do a maneuver. It's called a closed manipulation. We talk about manipulation. So we have to get some kind of relaxation or analgesia. If you get to it right away, sometimes you can do it on the field. Like at a football game, you can do it on the field. There's a little bit different technique you do, but if you get to it right away, you can do it. If it's been an hour and it's really painful and it's swollen, and you're going to struggle, and the patient's not going to be that happy with you. So a lot of times they'll give them some sedation. Some people they go back in by themselves. Some people have to go to the emergency room. They give them a little medicine to make them a little sleepy, and then you pull on the arm, and it, for the most part, comes right back in. And there's obviously bad ones and there's easy ones, but that's the general type of thing we're talking about. After it goes back in, we put you in a sling because it's painful and it's sore, and probably go to physical therapy for a few weeks. Try and regain your strength and your motion as the swelling and pain comes down. People have a dislocated shoulder can go on to have recurrent instability. And the younger you are when you dislocate the first time traumatically, the higher risk you are to go on to have this recurrent type of instability. And again, that goes back to talking about the difference between younger athletes and older athletes. The older you are, the less chance you have to be a recurrent dislocator, but the higher chance you are to tear your rotator cuff and things like that. So, talk now about ACL. ACL we saw in that picture was a stabilizing ligament in the knee. This is a side view. Femur is here, kneecap is here. ACL is this ligament here. It connects the femur to the tibia, and it prevents motion this direction, like we saw on that other slide. And there's a lot of ways you can tear it. If I go back here, you can get hit, right? The guy tackles you like that, or you slip and your knee goes in like this, and that can tear you. Not uncommonly, you get a non-contact injury where your knee buckles on you. Looks kind of like this if you watch a video of it happening. You get tearing of the ligament. Also, you can tear the MCL, or the stabilizing ligament on the inside gets torn as well. Sorry, I'm having trouble with this thing. You come down, landing awkwardly. Not uncommon to tear things. If you fall off a ladder, you come down awkwardly. Or if you're running and you have cleats on and then you try and stop abruptly and then your knee buckles on you, you can tear the ligament. So if we look here, normally the ligament connects the tibia here. You can get it from a hyperextension injury or that, what they call a valgus load, but it tears. You can have partial tears, but a lot of these are torn acutely, full tears. And you feel a pop in your knee. There's a classic history of the twist and the pop. So how do we treat these? ACL, for the most part, is treated surgically. And most of these happen in younger people anyway. But back to sports without an ACL is very unusual, especially a cutting sport like basketball, soccer, where you're making short stops and movements. Without that ligament, you go to make that twist and your knee just buckles on you. It's not stable. So, so you have surgery to fix that for the most part. ACL, you address the meniscus too at the same time. And that's a real common injury. You see on the news the football players tearing their ACLs and different people getting hurt with that. So women athletes and females are higher incidence of ACL tear, and that's for a combination of factors, anatomic, the size of the bone, the notch, neuromuscular, and hormonal. Different hormones which are, cause you to be more ligamentously lax, and so therefore higher risk. I'm just going to touch on each of these a little briefly. Each one of these injuries is a whole hour lecture in and of itself. Real common is a tennis elbow or a golfer's elbow. You hear these very commonly, and what it is a tendonitis. The muscles in your forearm are here, and they attach either to the outside of your elbow. This is your elbow joint here. From a front view, they attach either the inside or the outside. If it attaches to the lateral side or the outside, they call that a tennis elbow or lateral epicondylitis. Epicondyle is the name of the bone that it attaches, and itis just means swelling. Medial epicondylitis, they call that golfer's elbow. Now, I can tell you a lot of people with tennis elbow that don't play tennis, and a lot of people with golfer's elbow don't play golf, and a lot of tennis players with golfer's elbow, you can go on and on with the different things, but what it is really is a tendonitis. It's an inflammation of the tendon from overuse, and then when we talk about overuse at the end, we'll talk about repetitive small trauma. If you're not conditioned or you just did too much, and sometimes the tissue just can't handle it and it gets inflamed and swollen. Most commonly, you get pain and inability to go. You've seen the guys on the course with the brace on their arm for the golfer's elbow. So how do we treat that? Again, we'll come back to the Rice treatment. Rest, right? If it hurts when you go play golf, then we'll give you some time off to try and get it better. Because if you keep doing it, it's going to continue to hurt you. Or the brace, like we talked about, a little band on the arm. Cortisone injection is helpful in certain cases. Usually not the first time, but cases where the simple thing is the Rice treatment is not helpful. Cortisone can be helpful. Cortisone is an anti-inflammatory. Gets a really bad rap because you see it in the movies and the high school football players injecting it in the locker room and things like that. That doesn't happen for the most part in real life. But it can be a good adjunct if other things have failed. And too much of it's not a good thing either. Prevention, for this type of thing, you want to, again, warm up, stretch. You don't want to go out and be cold. Usually, get the blood pumping, get the muscles warmed up. You want to condition beforehand. If you haven't played tennis in 6 months and you want to go out and play a bunch of tennis, then you're probably a little bit at risk of getting injured because you're not conditioned. You're deconditioned, in fact, and that's a high risk of getting hurt or having an overuse injury. And when we talk about endurance type of things and stress fracture, that comes up. We talked about equipment, and one thing that's helpful is you take a lesson. Make sure your technique is good, your technique is sound, and help you with your game. Both tennis and golf is not a bad idea. We'll hit briefly, commonly is overuse, similar to a tendonitis or a bursitis. Bursitis is inflammation in the bursa. A bursa is a bag of water that surrounds joints. Every joint has some. Some are more prone to problems than others, but they just provide a fluid movement. We have tendons and bones and things that are moving across one another. If you have a tendon rubbing on a bone, then that can cause problems. So the bursa sits in between and lubricates it. But if you get inflammation in there, you get an irritation, that's a bursitis. Tendonitis we talked about. Briefly, I'll talk about stress fracture, stress reaction, and that's a spectrum as well. You get a reaction to a stress, your bone responds, and there's a slide on that, so we'll come to that in a sec. We've talked about the common treatments, and for overuse injuries, really the RICE and the rest. Rest is really important, and then focused rehabilitation, anti-inflammatories. Once you're feeling better, we get you back into sports slowly. And that's part of it. If you had an injury and you haven't been playing your sport for many months, you can't go back on the field and go compete right away. You got to build up to it, like we talked about with conditioning for your sport. And even young kids, we feel like the young kids are really, it's hard to hurt them, and they can just go out and play whenever they want. But even younger kids can do that, especially if you look at some of the throwers, the Little League pitchers and whatnot. So talk about stress fracture. Your bone is constantly responding. It's living tissue. It's responding to stress, and it's adjusting itself. And so when it sees a stress, it actually tries to reinforce itself. What happens though is if you continue to see a specific stress, you can develop an imbalance between its remodeling and its healing and the stress. And if you continue to stress it in that specific way, then it can't catch up. And what you develop is micro cracks in the bone, microscopic. And these can propagate if you continue the activity. Typically, these cause pain, swelling. The symptoms you would get out of a broken bone if you fractured it acutely or quickly. Very common in endurance athletes. Marathon is a classic. Classic one is military recruits. A lot of the literature and the studies are done at the academies, where they have a lot of military recruits get a lot of stress fractures. And the treatment, not surprisingly, is the rest, right? If you have an imbalance between your stress, then if you take away that stress, your bone has a chance to catch up, and it has a chance to remodel itself. And there's certain stress fractures that are more troublesome than others. If you have a toe or something, then that's less worrisome. If you have a stress fracture in, say, your femoral neck of your femur or something, if that fractured, it could be a problem for you permanently. One of the key things is cross-training. Cross-training is, if you're a marathon runner, you run a couple days a week, you want to mix it up. You don't want to run every day, all the time, the same, as many hours at a time. You want to throw in, a couple days a week, you want to go swim, or you want to go biking, or do a different sport, different stress. You want to get a different stress on that body. You want to get a different stress in the area, give your body time to catch up. And that's where cross-training really helps with recovering from a stress fracture. The first thing we do is take you off sports, put you on crutches, or tell you can't play until it's healing itself. And then on the X-ray you can see the bone starting to heal and it stops hurting. Then we get you back in and we do some cross-training where you go swim one day a week, and you go biking, and then we can keep doing your running, but we mix it up for your body sees different stress. So I think that's all I have for today.